I'm Sheena Larson, and today I'm going to be going over some of the structures of the different sensory organs. Starting off, I have this drawing here that I drew of a dog's ear that I'm going to label. Here are the names that I'm going to be filling in with it. So starting off, I'm going to label the pinna. And then the external auditory canal, which is both the vertical and horizontal auditory canal. And then the tympanic membrane. The cochlea. The semicircular canals. The auditory ossicles, which consist of the 3 small ear bones, starting off with the malleus, the incus, and the stapes. Now I'm labeling the vestibulocochlear nerve. And the eustachian tube. Here with it all filled in. For the outside of the ear here, the pinna, something common that can happen to it is an oral hematoma. An oral hematoma is a swelling filled with blood on the ear's pinna. The pinna is basically a central layer of cartilage surrounded by skin. They are formed when the animal keeps shaking their head from something irritating like an ear infection. This causes the skin to separate from the central layer of cartilage, and the centrifugal force from shaking their head breaks blood vessels and causes that separation to fill with blood. Oral hematomas are almost always located on the medial surface of the pinna. Now I'm going to be going over the structure of the eye. So I have my list of names. And then I have this structure, or this diagram of the inside of the eye that I drew. And this diagram of the outside of the eye. So starting off, I'm going to label the cornea. And the pupil. And the iris. The ciliary body. The suspensory ligaments, which on my rough drawing here, the straight lines down here. Suspensory ligament. the lens. The choroid. The retina, which on my diagram is this yellow line here. The optic nerve. The optic disc. The sclera. The tapetum, which I have as the red line in the choroid. The vitreous humor. The aqueous humor. And then for structures that are more outside of the eye, for the conjunctiva, I have them kind of overlapped with my lines here, but this line here against the eye, not this line, is the bulbar conjunctiva. And this one here is the palpebral conjunctiva. Down here, like right here, I have the upper eyelid. This is the lower eyelid. And this here, I'm trying to show the nictitating membrane. That's easier to see on the outside of the eye here though. So on the outside, where the upper and lower eyelid meet, on the inside of the corner of the eye is the medial canthus. And on the outside of the eye, where the upper and lower eyelid meet, is the lateral canthus. This here is the nictitating membrane. And these lines here I have as going into the nasolacrimal duct, which drains the tears into the nasal cavity. So for my finished drawings, I have the inside of the eye, and the outside of the eye.